plausible. No, there's no answer, frankly. They cannot explain. Maybe they can explain it to you because I didn't get a reasonable answer. The DSEN report is very clear. You could ask any independent witness what that language actually means. And the fact that Health Canada would further obscure the warnings is simply implausible.
And what kind of warnings are there at the provincial level from the health ministries?
They all depend on the regulator because these drugs are approved. They're approved by Health Canada. Now, of course, provincial formularies will decide which drugs are paid for and so on. But whatever is approved by Health Canada is available for the prescribers. And because Health Canada has not done its job over many years, there's a perception that these drugs are well tolerated and somehow you can live without acid. In fact, out of the Library of Parliament here, there's a book. They got it from the Library of Parliament. My staff pulled this down for me. I went looking for this because 30 years ago, this was well understood. What's epidemic in North America is not hyperacidity. In fact, it's hypochlorhydria. That's diminished acid. That's achlorhydria, hypochlorhydria in the elderly, chronic gastritis. I mean, 30 years ago, we had this figured out, that in fact, what's epidemic in North America is diminished acid, partly because we overconsume and because of bad eating habits like alcohol on an empty stomach and coffee on an empty stomach, which suppress acid release. And then we eat too much. So the symptoms of reflux, which most people are taking these acid suppressants for, are almost always caused by, in fact, low stomach acidity. So you can get rid of the burning by eliminating acid, but you're also eliminating your number one defense against bacteria and viruses coming in the oral route, and you're eliminating your ability to absorb minerals like calcium, like magnesium, like potassium, your vitamins like B12, and you're setting the stage for, failed protein digestion as well, which is essential for repair.
Have you noticed other drugs that have similar warnings that have been decreased over the past few years?
Well, I noticed that other people have been asking this question for a while from the regulator, and I did see a very good set of questions from a reporter a number of years ago, and the answers weren't satisfactory there. Once a product is on the market, Health Canada's tools currently seem to be hopelessly weak in actually dealing with products that are already on the market. They'll be much stronger after Bill C-17 passes, but they do have tools, and if they were acting in the public interest, they would be raising the bar in warnings, and they would be meeting with provincial authorities and those that write practice guidelines to make the necessary adjustments so that we can protect the public interest. Any other questions? All right, thank you.